Okay, wow. Yesterday, something pretty important got dropped, and it's about as close as a Friday 5 p.m. summer information drop as you can get when it's not 5 p.m. on a Friday in a summer, because they dropped it at 5 p.m. on New Year's Eve. Now, if you've watched my videos about H5N1, it's something that I talk about a lot. It is a burgeoning pandemic in the making. And one of the most severe cases in 2024 was a child in British Columbia. And this paper dropped yesterday, describing exactly what happened to them. And it's worse than what had been publicly reported. So the patient is a 13-year-old girl with mild asthma and a slightly elevated BMI. Those were her only pre-existing conditions. And if you use that information to write off this entire video, almost half of the people in the United States have an elevated BMI, and 25 million have mild to severe asthma, so that's a lot of people. Anywho, she was first brought to the ER on November 4th, presenting with 2 days worth of conjunctivitis and 1 day's worth of fever, but she was discharged and sent home. By November 7th, she returned because she had developed coughing, vomiting, diarrhea, and was having respiratory failure. She's put on bilateral positive air pressure and transferred to a pediatric ICU. At that point, she has ARDS, acute respiratory distress syndrome, pneumonia in her lower left lobe of her lung, acute kidney injury, thrombocytopenia, or low platelet count, and leukopenia, aka low leukocyte count, meaning her immune system was completely trashed. At this point, they do a test, comes back positive with a high viral load for H5N1, and they administer the first antiviral. Now, this article does detail all of the precautions that the staff then start to take, which I'm glad to hear. They wear eye protection, N95, and take other precautions against airborne or droplet infection transmission. That's a good thing. However, she gets sicker, and by November 9th, she is intubated and put on ECMO. Over the next 3 days, they add 2 more antivirals, and her viral load does start to go down, though unusually, it's not declining across the board. Her lower airways continue to have a higher viral load than her upper airways. The patient continued to be on ECMO until November 22nd. That means that she was on ECMO for 2 weeks. Now, ECMO is replacing the functions in both the heart and the lung. You only give that to people who are severely ill as a last resort to keep them alive long enough for their bodies to heal. And the longer you're on ECMO, the worse the damage is to your neurological system. It can cause permanent brain damage. And being on that for 2 weeks, that's really not good. She then wasn't fully extubated until November 29th, 20 days after she was admitted to the ICU. And the genetic sequences that showed adaptation to human respiratory tracts were found in her respiratory tract on November 9th. Now, that's a whole lot of information to dig from that paper. I'm glad they published it. I'm glad we know this. But if a relatively healthy 13-year-old ends up in the hospital with that intensive of a resource requirement to stay alive for almost a month, that does not bode well if even 1% of the people who get infected require that level of treatment. Because we don't have that many ICU beds. We don't have that many ECMO machines. We don't have that kind of staffing. So H5N1 from birds, yeah, that's really bad. And all the more reason that we should be doing everything in our power to stop it from transmitting so that it doesn't reach the right host and gain the right mutations in vivo to truly go human to human effectively. As it is not a good virus by any stretch of the imagination.